Arsenicum album. Now, we've had one plant remedy, which is Arnica montana. We've had one animal remedy, which is Cantharis, the Spanish fly. We've now got a mineral remedy. And this is a remedy that has been used medicinally for a very, very long time. It's been around certainly before Hahnemann. Arsenic, of course, used to be used in a variety of cosmetics. So there's Arsenicum sulflavum and rubrum, a red arsenic powder, which used to be used as a form of rouge for ladies' faces, and the white arsenic is what Queen Elizabeth I turned her skin white with. So if you look at a portrait of Queen Elizabeth I, she had white arsenic oxide all over her face. Interesting thing about arsenic in very, very small doses is that it produces a beautiful complexion. So in some parts of Central Europe where there's a tiny amount of natural arsenic in the drinking water, a few molecules per litre. I mean, we're dealing with very small quantities, but it's there. You'll find that the incidence of acne and the incidence of skin problems, particularly teenage skin problems and infected problems, is very low, and the locals who are in these areas have beautiful skins, generally speaking. So there is, from very tiny, minuscule doses of arsenic, a positive benefit to the skin. And as I mentioned, there is some competition between arsenic and sulfur for these double bondings in the keratin of the skin. When you raise arsenic up in terms of external exposure, you get all sorts of horrible skin problems, mostly of a kind of psoriatic picture rather than an eczematous picture. They're all hyperkeratotic and flaky and scurfy, and they're often white. If you look at the scales on arsenical skin eruptions, they're very, very white scales on it. Internal ingestion of toxic doses of arsenic produce two pictures. There's the acute picture. So if you want to poison somebody really quickly and get rid of them really quickly, and you give them a fatal dose of arsenic or a near fatal dose of arsenic, they have a terrible purgation. They're vomiting and their stools are loose and they're an absolute, completely washed out and quivery and slightly sweaty and completely flaked. Large, and they're almost in a degree of shock from fluid loss, and that is a very acute arsenicum album picture. If you poison somebody very slowly, like in some of the old murder mysteries, like arsenic and old lace, and you just stir in a little bit of arsenic into the wife's pudding or into her soup every night, a tiny amount, and you keep doing it, and you keep doing it, and keep doing it, you get a different kind of toxic picture. So the chronic toxic picture of arsenic produces agitation and restlessness and a loss of focus and a certain amount of internal anxiety. And as they start to feel that they're kind of losing it, their anxiety increases and they become more and more ritualistic, and they start to order things, and then everything becomes more and more structured and ordered, and they get themselves into more and more of a routine, and their ornaments are equidistant along the mantelpiece, and they plant out their pot bedding pants at equal distances of 6 inches all the way down the path, and they start to do all sorts of slightly OCD, obsessive things as they start to become slightly mad, and they develop a variety of GI symptoms. They develop their body thermostat changes, and they become rather chilly. They lose their subcutaneous fat, and they can become a bit thin and emaciated. They have disturbances of their appetite, and they sort of fade away with increasing anxiety through every step, and they become really very agitated. And it's there's some sort of internal recognition that there's this inexorable, gradual decline. And that is the chronic toxic picture of Arsenicum album, which is very different to the acute one, and which is again different to the phenomena you get if you have arsenic on your skin. So Arsenicum album is what we call a polycrest remedy because it has lots of different affinities. It affects the mind, it affects your metabolism, it can affect your airways, so you can get both infections and also restrictive airways disease. It will affect your bone marrow, and it will also, as a heavy metal, affect renal function, and it will affect skin and bowel, peripheral nerves, obviously. And because it is a drug or a medicine or a poison, depending on how you look at it, that crosses all these different systems, it has a number of different applications. So, for example, if you're dealing with somebody who's got a certain kind of psoriasis, and they give you lots of arsenical features for it, and there's some burning in the skin, better for warmth, which is classic for Arsenicum album. For whatever reason, their burning pains are better for warmth. There's an odd paradoxical symptom there. And if it tends to have this flaky white hyperkeratotic picture to it, and you want to give arsenic to that patient, and you give them Arsenicum album or one of the arsenic salts in a 6C, maybe 3 times a day, and you see how they get on, and you see whether or not the spots around their hairline or their plantar keratosis or their skin settles. Generally speaking, when you're using a remedy like Arsenicum album, you're looking for something contextual as well as just the local features, but it can be used locally. And there are several arsenic salts which can be indicated in some psoriatic patients. If you're using it acutely, you might use it for childhood diarrhea. It tends to be a viral enteritis, and obviously those cases are cases you'll want to put them on diaurolite or clear fluids only, and stop solids for 24 hours maybe. But if they are pale to the point of looking grey, if they're washed out, if there's a certain kind of restlessness to them and yet they're extremely fatigued, that is a very much an Arsenicum album acute picture. And they're pouring diarrhea, and the diarrhea is slow to stop. What you don't do is you don't give Imodium or anything to stop the stools. These people need to exteriorize, they need to reset their bowel flora, they need to get to purgate the enteroviruses. So you don't do anything to stop up their diarrhea. What you do is you give them Arsenicum album, maybe again 30C hourly, and keep them on clear fluids. And you should find that Arsenicum album shortens the recovery time for them significantly. Maybe even after a couple of doses, you'll find that they're feeling less washed out, less trembly, less pale, and the stools should start to form, or they should stop. The diarrhea should stop probably within, I would say, easily within 8 to 12 hours, but maybe even before that, depending on when you're catching them in the cycle. And then you've got a constitutional picture of Arsenicum album, and this is where life starts to get quite interesting, because there are some patients who will turn up in your practice with a number of different presenting complaints who represent the mind picture of Arsenicum album. And what they have real difficulty in coping with uncertainty. What if that spot is malignant, doctor? I think really you should take some blood from me. And that pain that I've got, I'm really not convinced that I shouldn't get an MRI in my neck. And there's this terrible fear of things that are uncertain. Now, there are certain things in your life, if you order things enough, you can try and create certainty around you, by sticking to a timetable and living within 4 walls and organising the ornaments along the shelf. You can kind of create predictability in your day by doing all those slightly OCD type things. But what you can never be absolutely certain about is your own internal well-being. And these patients can't live with that, and they become health neurotics. And they come back again, and they rebound again, and they rebound again, and they respond to some extent to reassurance, But sometimes the only way you don't see them for a while is if you give them the MRI or the CT scan that they're actually asking for, or if you take bloods and you tell them, phone them and say, your bloods are absolutely fine just now, nothing to worry about. And then you might not see them for at least 6 weeks. So there is, typically in the very advanced Arsenicum album state, they present with a variety of somatizing symptoms which can include burning neuralgias. And so, for example, some of your post-herpetic neuralgias require Arsenicum album. They may have had a herpes zoster infection, and they're left with a burning neuralgia around one dermatome of their chest, and it's causing them consistent discomfort. If they happen to be a bit restless, a bit obsessive, and thin more than fat generally, and a bit hyper-vigilant about their diet and about what they take and what they do and how their routines go, then they may well respond particularly well to Arsenicum album. They may have both some local features of Arsenicum and a constitutional picture for it. So Arsenicum album is one of those remedies whose toxicity and whose symptom picture is really very highly characterized. Sometimes they will find that they have things that they aggravate at the same time every day. Their biorhythm goes into a strict clock, and they have aggravations of their asthma or their chest at 1 a.m. in the morning, typically around that time. You will find that there are some patients where Arsenicum album is indicated in high potency in terminal care, where there's agitation, where there's fear, and there's real difficulty at emotional level. And some patients really respond very nicely to homeopathic Arsenicum. It makes a difference between an agitated, worrisome, fear-ridden death and one where they become into acceptance. So it does have some indications even at the end of life. Sometimes you'll find the Arsenicum album patients carry a bottle of water around with them and are permanently sipping small quantities of water. It could be that the kind of autonomic arousal that they've got permanently tends to dry their mouth out. They've got some dry mouth syndrome or some Sjogren's, but there's also likely to be a biochemical or reason for that oral dryness. You'll find that there are a few patients who develop burning tongue syndrome, who get burning in the tongue or in the lips, and they've got no deficiency syndromes. They have no response to vitamin B supplementation. They've got no alcoholism, and there's no obvious reason for it. And a few of those patients respond also to Arsenicum album. Again, I would probably use it in high potency and try it as stat doses first. If you're getting a partial response, then you can drop it down to a 6 and try and get a more persistent response by repeating it. So
in the terminal care agitation, what kind of
dose?
would you? Yeah.
I mean, I would say 30s generally, because if they're very weak and washed out, they might not respond to really high potencies of 1M and stuff like that, even if the picture is good for it. I would just stick with 30s.
And how often?
They could have it as often as hourly, easily. But I mean, if they're settling, you could spin it out to 2 hourly or 4 hourly. The other thing you can do with Arsenicum album in those situations, because they're often sipping water, you can actually put the medicating potency in some still water, still mineral water, a couple of drops, and actually leave it on their bedside cabinet, and they can just dose themselves with the odd dose of Arsenicum album.
And what about the patient, like with the burning neuralgia or that somatic symptoms, the kind of restlessness and health fear? What kind of dose?
Yeah, I mean, if you're looking at people, you will sometimes get patients who they're absolutely head to foot constitutional Arsenicum albums.
Yeah,
they often wear synthetic clothes. They often wear very blank sort of nylon-y like overcoats, and they come in with these slightly shiny, sheeny, sort of cheap nylon-y clothes, and for whatever reason, presumably because they wipe down well, and they're habitual hand washers, and they're thin and they're chilly, and they tend to have sleep pattern disturbance and aggravate and worry in the middle of the night, and they're obsessively looking for reassurance, and they can't cope with uncertainty. In those cases, it's worthwhile, I think, trying, in the absolutely classical ones, trying a 1M potency, particularly if there's not much in the way of physical illness. If they haven't got anything wrong with them, but constitutionally it's all in the mind, you could quite easily try 1M potencies.
And like twice a day?
Yeah, I wouldn't try it twice a day. I would try just a few stat doses. Yeah, a few stat doses, and then see if they change, see if they then relax, see if their sleep patterns improve, and see if the restlessness. Some of them have got leg restlessness and agitation. And if you have real restless leg syndrome, and their legs are going in the evening all the time, and they're dancing around and they can't keep their legs still, then you might use high potency arsenicum, or you might even consider zincum arsenicosum, which is a zinc arsenate in potency. So some of the restless leg syndromes respond really quite nicely to that. So that's a picture of arsenicum.